Hello, doctor. Today I want to give a quick tip on how to properly work with your hygienist, especially during new patient exams. So a lot of times when a new patient comes in, doctor will sit down and do an examination, hopefully a comprehensive examination on the patient, and they're going to list out all the restorative work that needs to be done. And then at the end of that, they'll oftentimes go on a cleaning, and they just toss it in there. They didn't do a perio chart, they didn't do any probing, and they didn't really take a look at the perio needs of the patient. So then what ends up happening is do some restorative work on the patient, they go away, they come back, and they get put on the hygienist schedule for a prophy. And then the hygienist sits down and is like, what the heck? This isn't even close to a prophy. Like this. No, and it's very frustrating, one, for the hygienist because it blows a hole in their schedule. And then it's very frustrating also for the patient because the patient was thinking, oh, I'm going to get, my $100 cleaning or whatever it is. And then suddenly the hygienist is presenting SRPs and some laser and Arrestin or whatever it might be, and it could be $1,000 or $1,500 for their perio, and that's a surprise for the patient. So it's not good for the patient, it's not good for the hygienist or the business. We try to avoid that as best we can. The way that we do that, or a way to do that, there's a few different options. One is, if it's going very slowly in the office and you have the opportunity to do the full perio eval, you're doing your probing and you're taking the measurements and you can see what it is that they need, fantastic. Have at it, do it. Second, if there's a hygienist available that has time on their hands that can come in and do that, fantastic, have them do that. And they can be before you do your restorative exam or after you do your restorative exam. Either way is fine, but it gets on the treatment plan. The third and most common option, I think, though, is you're busy, you're working on a patient, you pop in to do the new patient exam. Hygienist is busy, they've got one patient per hour, so they're busy scaling teeth or doing whatever it is that they're doing in the other room. So you come in, you list out all the restorative work that needs to get done, and then you can tell the patient, hey, listen, I don't know what type of cleaning you're going to need. When you come back, the hygienist is going to do an exam to see what type of cleaning it is that you need. Okay, you basically punt on the hygiene portion of the examination until we're able to do a proper job of it, right? So what we're trying to do, what we're trying to avoid is the quick, oh, it's just a prophy, and then having to undo that later and add more services in, which is again frustrating for the business and the hygienist, and also extremely frustrating for the patient. And if it looks like it could be SRPs, you could even say something like, it looks like you may need a deep cleaning, but I want the hygienist to do an evaluation of you, and he or she is going to figure out exactly what you need as far as your cleaning is concerned. And this will allow us to do same-day restorative treatment, but it will avoid the problem of getting a prophy on, setting the patient's expectation that, hey, I'm just going to get this $100 cleaning, and then come back in, and suddenly the hygienist is telling them that they need $1,000 or $1,500 worth of work. So again, when you do the exam and you're not able to do a complete perio examination, meaning you're not doing probings, those types of things, you can punt on that part of it and say, listen, I don't know what type of cleaning you're going to need. I'm going to have at your next visit, I'm going to have the hygienist do an evaluation of that and let you know what you need as far as the cleaning is concerned. So this was going to avoid some confusion in the patient's mind as well and make things a lot cleaner and easier for them. Thank you very much.